Greetings from the United States. It is my pleasure to talk to you about here at Teladoc Health how we are thinking about the future of longitudinal virtual care. My name is Dr. Bimal Shah, and I'm the Chief Medical Officer of Product Analytics and Quality at Teladoc Health. Telehealth has four primary goals. The first is to deliver a personalized experience to individuals at scale. It means providing the right care at the right time in the right modality. Second, it includes a remote collection of biometric, clinical, social determinants of health, personal health assessments, and other data directly derived from individual. And all of this data requires processing at scale in order to do dynamic risk assessments, predictive modeling, and biomarker analysis. Third, it means leveraging a multimodality approach. We know one size doesn't fit all. And this could mean synchronous versus asynchronous communication with the provider team, audio versus video versus chat interactions, and also could mean digital or human engagement depending on the needs of that individual. And finally, telehealth really helps to promote health equity and access. It allows expert and high-value clinical opinion regardless of someone's geography or need to travel. It can provide home-based care and diagnostics. And there's just increased convenience. You don't have to miss work in order to make an appointment, and you don't have to worry about childcare or pulling your children out of school in order to get high quality, high value care. Here in the US, we saw a huge structural change in terms of the adoption and acceptance of virtual care. And this was really driven by the COVID-19 pandemic. And during the first COVID-19 peak here in the US, starting around mid-March, awareness of telehealth services grew just from about half the US population to 75% of the population in just 5 weeks. By the fall, more than 3/4 of Americans were interested in using virtual care as compared to 11% prior to COVID-19. And up to 1/3 of US adults reported that they would leave their current physician for a provider who offered telehealth access. Now, this doesn't mean they would abandon full in-person care and a structural shift in how all of their services and care are delivered, but meant that about 2/3 would want a virtual doctor to coordinate care with an existing doctor for their needs when appropriate. And we saw some really interesting dynamics out of the COVID-19 experience where there was great opportunity to enhance care using virtual modalities. And once again, here in the US, this is a survey that was done and that expressed a couple of key domains that were really ripe due to issues around access to care, the ability to leverage remote monitoring, and conditions that lend itself to ease of diagnosis and treatment. And you can see here, the one that was most commonly identified as ripe for disruption was endocrinology, followed by rheumatology, gastroenterology, and you can see on down the list here. And really, in the US, this highlights some critical access needs that we have for certain specialties like endocrinologists for diabetes care and rheumatology for autoimmune disorders. But once again, demonstrates that there are places where the infrastructure for virtual care can really make a difference to drive high value care into those populations that need access to really important care. So let's take a step back and say, what have been the technological developments over the past 3 decades that have enabled virtual care and how we are envisioning the care of the future in a Teladoc world? In the early 1990s, the explosive growth of the internet through easy-to-use browsers and portals unleashed the ability to get information on demand and hence connectivity through a wide variety of communication platforms like email and chat. Some of the examples of the companies during this time were Netscape, Yahoo, AOL, and WebMD. Cloud computing started to take off in the mid-2000s, providing reliable, efficient, secure, and scalable infrastructure with an always-on access to high computing bandwidth and throughput to unshackle infrastructure from being local. And things like Amazon AWS and Google Cloud and Microsoft Azure are all prototypical examples of cloud-based computing. About the same time, mobile phones, and specifically smartphones, underwent a significant evolution, providing tremendous computing power in the palm of one's hand, alongside the appification of services and information and a new level of personal portability and connectivity. And once again, Motorola, Apple, Nokia, BlackBerry were part of this. And in the past decade, we've seen miniaturization of electronics, sensors, and wireless chips that have ushered a new wave of devices that provide continuous biometric feedback with the fidelity and frequency that was previously only achieved in a hospital. And you can see Fitbit, Withings, AliveCore, Zypher are examples of companies that have really miniaturized these wearables and sensors to give us this really clinical grade information. And then more recently, we've seen intelligence in the form of artificial intelligence and machine learning, new ways to process and automate huge reams of data to help us build better predictive models as well as enhance personalization. And we'll talk a little bit about this, but this is things like Tesla and Alexa and IBM Watson that have really led the way in terms of this technological development. And so let me just give you some examples of what's enabling virtual care today. So you can see here on the left, we used to do sleep studies, and we still do in most parts of the world, with hooking up people to all these different probes and monitoring them at night. And this is to figure out sleep patterns, respiratory rate, O2 saturation, and heart rate. Now this has all been miniaturized into a ring that fits on your finger called an Oura ring that has all these tiny sensors that does all the things that the device the gentleman's wearing on the left now that can fit on the form factor of a ring with the same fidelity of information, the same clinical grade information, and in a much more comfortable form factor that you can wear 24/7 to get more information about what's going on with that individual. Similarly, we used to hook up people to 12 lead EKGs, you can see here on the bottom left corner, to really get an understanding of the function of the heart and abnormalities there. And now that's been miniaturized to a single little patch that sits on your chest to give you the same information, but now in a form factor that you can walk around with 24/7 and gives us a tremendous amount of insight and information on what may be going on outside of just that period of time that you're sitting at the doctor's office getting that 12 lead EKG. And then we're also automating the ability to get vital signs for physical exams. So you can see here on the left side, a blood pressure cuff that we get. On the right, this great technology called Bina AI that uses your smartphone camera and can quickly get an assessment of your temperature, your O2 saturation, your respiratory rate, your heart rate variability, and even some things about your mood. And soon to come, your blood pressure as well. And likewise, we've replaced the stethoscope of listening to someone's heart or lungs with this device on the right called the Echo device, where you just put it on someone's chest and quickly it gives you some waveforms and information about what's going on in that part of the body. So once again, tremendous amount of technology that's being revolutionized with the miniaturization of computing power and sensor technology. And then once again, with remote monitoring and cellular connectivity and cloud computing, we're able to do new things, particularly with low bandwidth considerations. And here you can see the Livongo glucometer, where it's a cellular connected two-way device that allows someone with diabetes to check their glucose. And instead of just sitting in that device static, what it does is through a cellular connectivity, goes into the cloud, gets processed, and is understood in context of not only your glucose at that moment, but all of your previous glucoses, the time of day that you had those, as well as what type of medications are you on. Are you a person with type 1 or type 2? And then shows you real-time feedback with digital content and analytics to help better support how an individual manages their diabetes. And this is really done by bringing all of those things together. Better sensor technology, cloud computing, cellular connectivity. And in this way, a person's one click away from contacting a health coach, able to share their finger stick and glucose information with the provider right off the device, order more strips to check further for their finger stick glucoses, and also contact support for further help. And this is the future of how we will think about digital remote monitoring for people with chronic conditions. And it's here today in both diabetes and hypertension in the Livongo stack. And then finally, if we think about personalization, we know that this enhances the experience. And here I show you two Netflix screenshots of a homepage, one of mine on the left and one of our product marketers on the right. And Pat's, a millennial, I'm a little bit older. And you can see here, for the most part, there's very similar recommendations that we get from Netflix on things that we might be interested in based on our age, our gender, and our viewing habits. But what things like Netflix, Amazon, Google do at scale is they start to understand patterns in the aggregate and start to individualize that, understanding your context. And so here you can see on the very top right-hand corner for a Highwayman, Pat has a very different icon than I do for the exact same show. And so this is where Netflix understands what resonates with me relative to Pat, and it can be simply a change in the picture that drives personalization to enhance you clicking on that to drive behavior to watch that show. And so once again, personalization at scale using huge amounts of data, processing those, understanding with predictive analytics how to personalize content is really powerful. And what I'll talk to you a little bit later on is how we're doing that at scale at Teladoc to help people manage chronic conditions in a longitudinal way. So we know that one of the challenges with chronic condition management is people spend 99.9% of the time living a chronic condition outside the four walls of their doctor's office or a hospital. And so they have to manage their chronic conditions without any support. The data that they collect is usually disconnected from the health system, it's disconnected from their provider. We know when they come in and see their physician, they typically have 5, 6 things that they want to talk about. And so there's just not enough time for a physician to help an individual manage complex chronic conditions. And finally, we know that all this takes not only time, but increased cost as people are left, alone to manage complex disorders. And so here at Teladoc, what we're really building is how do you put the individual at the center of all of this and start to think about how would you rebuild virtual services around them. And we know that you can't build just one service, such as primary care. You can't build just one service like urgent care. You really need to start to bring it all together. And what we have today here at Teladoc is the ability to really think about holistic care for an individual's journey for whatever they may go and seek care for. And so you can see here mental health, acute urgent care, specialty care, chronic disease management for chronic conditions such as obesity, hypertension, prediabetes, and diabetes. And then also the ability to help manage complex care such as second opinions regarding surgery or cancer treatment. And then finally, a single nidus to bring that all together in terms of a virtual primary care offering that I'll talk about here in a second. And so whole person care really starts with primary care at the center. And we know that primary care is really important for delivering high value care. We know that people who see primary care providers have their issues identified earlier and more effectively. They have better medication adherence. They are more likely to be referred to the appropriate specialists, and they have better care coordination with specialists as a result. They also have better chronic disease management, are more likely to follow up with appointments, and gain better health outcomes at a lower cost. And this is why the central nidus for everything that we're building at Teladoc is going to center around virtual primary care. And as we think about then how you build upon that, we're always going to have a layer of digital enablement for all of our programs. And on building upon that, we're going to have a care team that's going to help you manage through those complexities that I mentioned, whether it's your mental health problems, whether it's your complex care, your specialty care, or just your primary care. And we call this the step care approach, where we start with the people that are most enabled and the best equipped to help you manage whatever's going on with you at that point in time. And sometimes that might be a health coach, which could be a layperson, it could be a dietitian, it could be an exercise physiologist, a nutritionist to help you manage your lifestyle and behavioral changes. It could be a nurse or a therapist, all the way up to a primary care physician, to specialists, to even subspecialty experts. And all of that's going to be grounded on high clinical quality that's evidence-based through practices and policies, as well as continuous quality improvement assessments to make sure that we're delivering the highest quality care. And then we're going to drive that with data through personalized and predictive analytics. And I'll talk about this in a second, about how we're able to nudge people to take the right actions able to enable better care. And then we're going to integrate all of that data at the point of care for the provider and provide that information back to the individual. And the goal is to make this seamless. So as an individual comes in with any of their problems, we're able to direct them to the right level of care based on their needs. And so we'll take a quick assessment and then decide, using our proprietary algorithms, to suggest where they should go for the most effective, cost-effective, and right care. And then part of that process will be to collect that information ahead of time so they can maximize that interaction when they do get on the phone or a video with a provider. And this is where we're really driving for personalization in terms of how we think about longitudinal care. And this is no different than how Amazon recommends products to you, or Netflix recommends movies to you. What we do is we take in a vast amount of information. Some of that's pharmacy data, some of that's data from our devices, and some of that may be information directly from the individual. And what we do is we make interpretations of that data so that we can understand where they are on their healthcare journey. We can identify where there might be gaps. And then what we can do is, using our AI technology, nudge those individuals with specific messages, which I'll show here shortly, in order to deliver content and an action to that individual to take. And then we use behavioral economics in our nudge framework. We use a little bit of gamification to give them some rewards and some challenges, and really support that both with digital and human coaching to enable them to meet those goals. And then what we do is we learn from that, and we understand what actions did someone take, what did they change about the behavior, how did their blood glucose improve, how did their med adherence improve, and then we iterate on it in order to improve the frameworks of how we think about reapplying messages, introducing new messages, or even just changing the message that someone needs to receive in order to take better action for their health. So how do we actually deliver this at scale in terms of the personalization of behavior change? With Livongo for diabetes, what we collect is about 40 million blood glucoses in a year, and we deliver over 400,000 messages in any given period of time. We know that 90% of our members check daily, so we have the opportunity to interface with them at a moment in time where they're leaning in, they're thinking about their health. And we know that for people with diabetes, checking in the morning is probably one of the most important actions that they can take. Number one, to understand how their glucose control is doing and how well they're managing their diabetes. And what we showed is that if we, in the morning, if we nudge an individual to start taking their blood glucoses before breakfast, over 40% will do that action after receiving that message. And that's a great example of a behavioral health nudge. One of the things that we also show is that once someone has taken that action and we've gamified it by giving them the information of why that's important and providing them a challenge to say, hey, for the next week, start checking every morning. We know that that pattern is sustained for over 2 weeks, with 75% of those individuals continuing to check in the morning. And so this is just one of the ways that you can leverage digital technology, connectivity, personalization at massive scale with a very strong data analytics platform in the background, and leverage AI in order to deliver behavior change for people with chronic conditions. So how does this all get put together in terms of how we think about virtual primary care, how we think about remote monitoring, how do we think about those behavioral health nudges in the context of an individual's healthcare journey? Well, let me give you the example of Claire here, who, through our targeted engagement program, she learns about Teladoc and registers and requests her first visit. When Claire connects with a Teladoc physician, they discuss the importance of managing her high blood pressure. She's referred into a Livongo for hypertension program that includes a cellular connected blood pressure cuff and monitor that's shipped to her home. It's automatically provisioned to her, so there's no setup for her. She just opens the box, She starts checking her blood pressure, and the information starts automatically populating on her Livongo app, on our mobile phone, and on our web portal. Using the connected blood pressure cuff and monitor, Claire and our care team start to monitor her hypertension. She receives Livongo health nudges to encourage her to stay on track. And based on the Livongo clinical data that Claire shares, a teledoc physician writes for a blood pressure medication, knowing that she has the opportunity to improve her blood pressure control. And then Claire continues to check her blood pressure, and the physician has the opportunity to see, did that actually help improve her blood pressure or not? Claire's also interested in losing some weight because she knows that can help with her high blood pressure. And so she consults with a teledoc nutritionist. And during the course of her managing her hypertension, she develops a sinus infection. And so she has an urgent care visit with a teledoc physician who writes her a prescription and advises her on some other medications to help with her symptoms. At work, Claire's also really stressed, and she's starting to feel pretty anxious and requests a mental health therapist appointment who helps her with some techniques through cognitive behavioral therapy techniques to help start to manage her stresses at work better, to help manage her anxiety. And so with the support of the care team, ongoing blood pressure monitoring, and health nudges, Claire starts to achieve her target weight and blood pressure and continues healthy habits. And once again, this reduces medical care costs as we improve her outcomes over time. And this is just one of the many ways that we're integrating the virtual care experience with continuous monitoring and a longitudinal care approach. And we have data to start to show this. In our pilot last year, that we showed that for people who are in our virtual primary care offering, more than 30% of individuals completed their annual exams and received personalized care plans. 20% of these were referred to high-quality in-network specialists and facilities to get additional testing, get additional care that were unique to their needs. We had a tremendous Net Promoter Score of 95, which just shows how delightful, how seamless, how frictionless, and how easy we made this experience for people to get their care. And we had 10% of people that were referred to a teledoc specialist for virtual care, which is really great, as we were able to expand virtual care to subspecialty care as well. And during this pilot, we newly diagnosed 50% of people with hypertension and 25% of people in that pilot with diabetes. And so a real great opportunity to help people in the early stages of chronic conditions start to manage these conditions on an ongoing basis. And as part of our longitudinal care and remote monitoring programs, we've got some really great data points. For the Livongo for diabetes and hypertension programs, we have an average member NPS score of 60, a 90% member satisfaction rate, and 92% of concerns that someone comes to teledoc for are resolved in the first visit. We know that 50% of previously undiagnosed chronic conditions are diagnosed in a virtual primary care visit on our platform. And this translated into a 71% reduction in hospital admissions of people on our program compared to those who were getting traditional care. And for our longitudinal diabetes program, this also resulted in really clinically meaningful reductions in blood glucoses that translated in a 0.8% hemoglobin A1C reduction. And then finally, this all translates into cost savings. And once again, this is U.S. cost savings, but we were able to save $517 in claims cost per urgent care visit, $180 in savings per participant per month on our diabetes solution, and then $76 per individual per month for our cardiovascular solution that includes our hypertension program. So just really tremendous impact that we can show by leveraging virtual care and emerging technologies to deliver on the promise of longitudinal care in this new environment. Thank you so much, and I'm happy to take any questions.